And good morning, everyone. We're back here at 6:46 a.m. on KFYO Mornings. Dave King and Matt Martin. And as promised, we have a representative from Covenant Health Centers. Kerry Hendershot, who's the Director of Primary Care for Covenant Medical Group, is here. And we're talking. Good morning, Kerry.
Good morning.
Let's get real close to that. You have to talk real close to that microphone. There you go. We've been talking all week about the urgent care centers and when people should go there. And so what do we want to cover this morning?
Well, basically, we want to go over just kind of things we're able to do at the urgent care centers, and want to reemphasize that we're part of the Covenant network, and so we can move people within the Covenant system pretty easily, whether it's from our urgent care to the emergency room to directly to the hospital, depending on the patient's needs at the time of presentation.
So when should people go to an urgent care center? I guess that's the big question.
Yeah.
I saw these things. It seemed like they popped up overnight all over town.
Yep.
And I was confused because it said emergency room.
Right.
And I think of an emergency room as an emergency room at a hospital where you go when
Right.
you are seriously injured.
Yeah, well, I think as Dr. Berman has talked earlier this week, the two emergency rooms that we've added, the former West Texas ER locations, are both true full emergency rooms, and so they function as an emergency room, and so they're actually part of the extended part of the emergency room department at Covenant, the actual medical center.
So they can take on any, like a severe heart attack or maybe a severe laceration or something.
Sure. They're well equipped.
And they get you stable, and then
they can. The nice thing about them, if you go there, they can directly admit you to the hospital, so you don't have to go to ER to ER. They can see you there, treat you, and then get you admitted to the hospital if you need to go to the hospital. Mm-hmm. So the difference for us, because they are a full-blown emergency room, with that, unfortunately, comes the cost of an emergency room. So it's a lot more expensive setting for to treat medical issues. And so that's kind of where we come in. We're more aligned to treating coughs, colds, lacerations, minor lacerations, some broken bones, generalized abdominal pain. And so we're well equipped for that. We have 4 walk-in clinics or 4 urgent care centers in Lubbock associated with the medical group. And as such, we have full capability lab and x-ray in all the facilities. And so we're able to take care of pretty much anything. And should the need arise, like I said, if something ends up being more severe, then we're able to transition the people into the health system as they need to.
So I've used an urgent care clinic from y'all if I have any issues. One of the things is that if you go during normal business hours, it's not considered urgent care costs. Mm-hmm. In other words, I walk in and I get my normal Covenant costs. Mm-hmm. Whereas if I walk in after 5 and have to see someone then it gets the urgent care, which is still not emergency room, but it's a little more expensive. Right. But you have that accessibility after hours,
right? And we have extended hours. We have 4 clinics, and in each of those clinics, 3 of the clinics were open. It's 8 to 7 Monday through Friday, and then 9 to 5 Saturday, noon to 5 on Sunday. And then the urgent care clinic on 19th and Quaker is our full extended, the most extended hours clinic we have, and that clinic is get this right here, 7 to 10 on weekdays and 8 to 8 on the weekends. So, and that clinic's open 24 hours, or not 24 hours, but 365 days a year. It doesn't close.
So you always have access. So if something like a cold overnight or something, and you need to see someone, and you can wait until 8 o'clock the next day, then if it's a weekend, you can be
seen. That's right. And like I say, the cost is generally less expensive. We can see people pretty rapidly. Because we're not an emergency room, we don't necessarily have the volume of paperwork. The workup's not in depth, and so we can move people through a lot in a more timely manner than you could, in the emergency room. Things get bogged down in the emergency room, and they have X amount of beds, and once they're full, then the wait time starts. Mm-hmm. And so.
Yeah, well, I've just been through that. I've had a series of things happen, and I spent a day and a half in an emergency room because there was no room in the hospital. This is back with the flu epidemic.
Yeah, it's been I think the flu epidemic this year was outrageous. I think our 4 primary care clinics in January alone did over 10,000 visits. Just our walk-ins. So it's crazy.
We're over that now, are we not?
Yeah, I think the flu's kind of died out for now. Yeah,
but now there's still some strep throat going on.
A lot of strep going
Just
around.
a few weeks ago, I had a case of strep throat. Saw my doctor, got a shot, felt better, and then woke up 2 days later on a Saturday morning. I thought I was going to die. Yeah. And my wife told me, go to the urgent care. I mean, man, I had to see a doctor. Yeah. And so that was my experience with an urgent care place.
Right.
And did get some antibiotics that did the trick this time. But, wow. That strep can be bad stuff.
It can, and especially in adults. It makes you feel bad. It really does.
So we only have a few minutes, but one thing that I remember seeing when I was there, I haven't used it yet, but apparently you can check in.
Sure.
And then be able to show up right before your appointment.
Sure. If you go to, let me get this, covenantmedicalgroup.org/urgent care, you can use our program. We have an app called Check In Now. And so you can pre-register and be seen and pick the time. And you also have the ability to look at all our 4 clinics, see kind of what the wait time is at those 4 clinics. And then you can try to pick which one you want, stick in a slot. And then when it comes to your time, there'll be some response texting back and forth with that app. And then they'll tell you what time you need to you can show up and be seen. So it kind of eliminates the walk-in clinic. The other nice thing, too, is if you don't have a primary care physician, and certainly for continuity of care, that's the most ideal thing, is to have a physician you see, but that's not always practical, so to speak. But it's a way to get to meet doctors who potentially could be your doctor, because most of us, when we work there, all have private practices as well. So we're building practices.
Can you give us maybe a price range of what it would just cost to see a doctor?
Well,
say you have some situation like I had.
Yeah,
you just need a prescription.
Yeah, so basically. Basically, it's going to be based on the copay. So your insurance copay, whatever that may be.
Listen,
so
we're up against the clock,
okay.
And Dr. Hendershot, we appreciate you coming out and relaying some information for us.
Thank you very much.
All right, and we'll be back with more after this.